Boardetella. Now, Boardetella is a specific organism which causes our specific disease known as pertussis. Now, pertussis is actually a whooping cough disease. Now, how it is caused? Now, the thing is that this disease is quite contagious, so it is spread by airborne droplets. When this organism pertussis enters the body, it attaches to the cilia. Now, it attaches to the cilia by specific filaments known as filamentous hemagglutinin. If our IgA and antibodies are sufficient in amount, it helps in prevention of binding of this organism to this. Similarly, meaning our immunity is quite a lot, that is, it is not allowing pertussis to happen. But if in certain human bodies where IgA levels are quite decreased and they are more susceptible to acquiring Boardetella or pertussis. Now, what happens next is that it releases certain types of toxin. Now, this toxin binds to the GI protein which is present on the cilia. This induces a cyclic AMP, increases cyclic AMP, results in edema. Now, edema will it will hinder the celiac movement, and it will also cause swelling of the mucosa. Apart from that, this activation of GI proteins also induce a lot of chemokines inhibitors. These chemokine inhibitors, what it does is that they prevent the leukocytes or the lymphocytes to enter the tissue or even enter the spleen or the lymph nodes which are present in the submucosa, in order to provide protection against it and in order to drain this fluid. Similarly, the edema would persist and the lymphocytes would not be able to get into the tissue in order to defeat this. So in the blood, what we'll see is a lot of lymphocytosis. Apart from that, this cyclic AMP, adenyl cyclase enzyme, which is produced by the GI proteins by increasing the cyclic AMP, is also engulfed by a lot of macrophages or neutrophils. Upon engulfing of this enzyme, what it happens is it becomes full, so it cannot destroy this bacteria and have any action against it. Similarly, this bacteria is quite protected and it causes further damage. Sometimes few parts of the proteoglycan breaks off the surface and it attaches to the it attaches to the cilia and similarly cause destruction of the cilia. And similarly, if the cilia will not beat in an upward direction, the mucosa which is present or which is continuously forming by the goblet cells over here would not be expectorated by the human body, which will accumulate and cause serious manifestations. Now, if your cilia is inhibited, what will happen? Your mucus production would be increased. Now, the patient presents with what types of symptoms? They present with, as it is affecting the upper respiratory tract, there will be paroxysmal cough. Now, this cough is very specific. It will cause a hacking cough, like followed by a respiratory whoop, by which we give this disease its name, whooping cough disease. And as it is not able to expectorate a lot of sputum, so this hacking cough would be followed by copious amount of sputum. Now, this disease can persist about approximately up to 1 to 4 weeks in young children, and this affects children mostly at the ages of less than 2 years old or up to even 7 years. Now, it can also occur in adult, but in the adult, the cough is non-whooping type and it can even occur up to approximately 100 days. So it is also known as 100 days cough. Now, the next thing is that how we diagnose it. In the laboratory findings, what we do is we check the blood. We know that a lot of lymphocytes are present, so there will be lymphocytosis, or also known as leukocytosis. We would do a nasopharyngeal swab. By nasopharyngeal swab, we can identify the organism upon any staining, and we will see that we have a gram-negative rod which is encapsulated, which is actually small coccus type. Now, this organism is also grown on certain media, which is known as boardate gangu medium. But the rapid diagnosis for pertussis, because it is a quite threatening, alarming disease in young children, we use direct immunofluorescence antibody staining of the nasopharyngeal swab. This is a very good test because it helps in identification of the organism a lot quickly, and we can also do PCR in order to identify by its DNA. Now, the treatment of choice is azithromycin. This decreases the number of organisms in the throat, and as you know that it is quite it is caused in children, and it is very virulent, and it is very contagious, and can easily spread and become endemic. So what we use is we use vaccines against it in order to protect our little children, in order to develop immunity against it and not die of a whooping cough, because it is caused damaging to the cilia, so their progression would lead to a lot of complications and even death. So prevention is by using live or dead vaccine. Normally killed vaccine is not used. We use DTAP, which is a pertussis combined with diphtheria and tetanus toxide antitoxin, and this is actually killed tetanus bacteria and killed endotoxins, which we combine with pertussis. Now this is given normally in the EPI schedule at 12 months, and the booster dose is given at 12 to 15 months. Apart from that, we also use a acellular vaccine, which is consisted upon purified proteins.